My name's Ira Coleman, and I take over as chair of McDermott Will Emery, an international law firm with about 1,000 lawyers, on January 1st, and I'm really excited. I came over to McDermott from a wonderful law firm 24 years ago, and I started getting involved in healthcare, and then I became the head of the healthcare practice, and then a great man, Larry Gerber, who was a former chairman of McDermott, one of my mentors, did a little science experiment and put a young kid in charge of the Miami office, and that was me. And that was probably 17 years ago. And I grew the Miami office from a small, sleepy office to a real powerhouse. We grew it through the use of some great strategies and great people. And the firm has recognized this, and then they put me as head of global corporate, so where I ran the worldwide transactional operations of the firm. And then my partners elected me as chair in September of this year, so I'm proud and humbled to serve as their chair. I think talent management or talent flow management is the big challenge. If you're a law firm and any professional service firm, your people are your most important asset. It's not the beautiful offices, it's not the furniture, fixtures, and equipment, it's your people. And they get in the elevator and they go home every day. So they better love the place. They better have a lot of happiness and satisfaction in the work that they do.
You mean your staff?
I mean the lawyers and the staff, everybody who's here. They're important, and they are the ultimate, and that's what the clients see. So if your employees are happy and doing terrific work, they're going to make themselves indispensable to the clients, and the clients are going to give back to you, and you'll have a great virtuous cycle going on. Great clients means great people will work for you. Great people that work for you means you'll do great work, and then you'll get better clients, and the whole virtuous cycle continues. To keep them happy. To keep them happy, to keep them engaged. And what we find now is, I think there's been some studies that are out there that say people who are entering the workforce now are going to live to be over 100.
Wow.
So you're going to have people who come in and work like the Dickens, and then maybe take time off to do something else, like do a startup or really raise their family, and then they're going to come back into the workforce. So your engagement has to be at all different levels, and you have to be a welcoming organization to all these different arrangements. So that's a big challenge.
The
Flexibility,
Yeah.
working with them. These are terrific, smart people that can do anything and work anywhere. And there's a war for talent. So you have to differentiate yourself. It's not just paying them more money. It's giving them amazing opportunities to do great things. A gentleman by the name of Mike Siegel, who was a mentor to me early on, managing partner at Broad and Cassell, taught me the business of law. And he had represented a lot of physicians and a lot of healthcare entities. And Mike still practices today, and we sit next to each other at Heat games because we have our Heat season tickets right next to each other. So Mike taught me the business, and he was a tax lawyer and got into the health side of things, and he taught that to me, and I've never forgotten the opportunity he gave me, and I loved it. I loved reading about deals that we did on the front page of the Wall Street Journal and the New York Times, once a week, and everything. It was a heavily regulated, multi-trillion-dollar industry that's constantly changing. So it's a lawyer's dream job. We do deals. I do deals. My teams do deals in usually private equity, making investments in healthcare companies.
Oh, okay. So like mergers.
Yes, merger and acquisition, things like that. So what people want is they want to bet on the companies that are going to help change healthcare for the better. So that's why I like doing it. If people make investments and build great healthcare companies, they're helping the public. They're going to be giving back services to the public. Some of that money that they're generating gets back into the to helping patients. So I like that. There are some demonstrative measures where we might not be as good as some other developed countries in a particular area, but I think overall our healthcare is probably the best in the world.
Okay.
Can we always do better? Yes.
Yeah.
And can we take more wasted administration out of the system? Absolutely.
Okay.
And I think we also are a very pluralistic society, that we want to give people choices. Choices cost money. And you know, we don't drive one kind of car. You know, think how many cars are going around the streets in the United States. That, you know, if you looked at that and you compared it to another developed nation that has less choices there, they might, you know, show that their automobiles get more miles to the gallon or something like that. I think private equity likes the healthcare industry because there's tremendous opportunity for growth. In a $3 trillion industry, if you do something better, okay, and you change something for the better, and it has widespread application, there's not only are you doing a lot of good for society, but there's a lot of money to be made. So if you know, we come up with a new way of getting some administrative waste out of the system, you know, then it's very helpful. So, you know, I'll give you an example. You go in for surgery. Before you go in for a little minor surgery, maybe the doctor took your blood, maybe the surgeon, you know, your primary care guy did your blood work, the surgeon did your blood work, and then you get to the ASC and they want to do your blood, the ambulatory surgery center or the hospital, they want to do your blood work. Well, what if it was all coordinated and everybody could see the blood test and the results and that it was already done? It's not better care that you got 3 blood tests. It's just the way we do things now. If there's a way to only have 1 test, that's better for you, and that's better for the system. So those are the kind of changes that I think we're going to see, and that'll be made. And then just the coordination of care and the way we set up things right now, like older people who have multiple conditions are the most expensive patients to take care of, okay? And they have to go to a whole bunch of doctors. Well, the way we have the system set up, it's pretty easy for the doctor, okay? They're in one place, and we got to shuffle this sick patient to 4 different appointments, okay? That's hard to do. What if you had a nurse practitioner or a caregiver come to the patient's house with a FaceTime on an iPad and did 3 doctor visits with that you know, patient right there, and the doctor could see them remotely, and you save that patient all this time. And then you spend the time with the patient to make sure that their house is set up to be safe, that they have the right food in the refrigerator, that their medication's correct. These are the things that matter in people's health. So there are companies that are doing this. You know, they go in with a backpack filled with high-tech devices, all wireless, all connected to the internet, and they get all the data points on the health and medical history of the patient, and then they have the visit with the doctor electronically through a FaceTime or a Skype type of video, and that's much better for the patient. And then the care worker can actually spend the time. So you know, doctors always say, you know, well, you got to change your diet and exercise. Well, wouldn't it be great if you're actually, you know, getting somebody to go help the patient go shopping, bringing back the food, you know, spend the hour that way, or show them the exact walk that they should take and walk them around the block and spend the hour that way. You know, these are the kind of things that are making a difference and that are changing care.